My name is Dr. Branin. I'm a naturopathic doctor in New York City, though in this virtual age, I'm actually seeing patients all over the world and all over the states. Today, I'd like to talk about something that you might have already heard of, but aren't really sure what exactly that is leaky gut. So leaky gut, which actually sometimes we think of some of these conditions as it was just like wacky, like pseudo alternative science, but actually leaky gut, also known as intestinal permeability, is an accepted condition by the mainstream medical community. So when we're thinking about leaky gut, we're focusing primarily or almost exclusively on the small intestine. So again, like we think like intestinal permeability is like the more accurate term for leaky gut. And so under normal conditions, our small intestine are virtually, or not virtually, but are not so permeable, meaning they do not readily allow certain particles to pass. Though it would be really, maybe that'd be an interesting other video to do, but I could also talk about all the different regions of the small intestine that are responsible for the absorption of certain nutrients. So certain nutrients definitely do get absorbed under normal circumstances along the small intestine, but typically the small intestine is not permeable to certain molecules. So what kind of molecules are we talking about? Probably primarily if we want to think about, what is the small intestine for, or what is our digestion for? It is for the breaking down of food and to assimilate the nutrients from the food so that our bodies can use it. So one of the big particles that could be possibly passing through are food particles, also bacteria, and then a variety of different waste products. So you might be wondering, why is this happening? Well, there's many different reasons why there is this increased permeability. So basically, when we're thinking about the permeability, we are thinking about permeability or compromised tight junctions. So we think about all the cells that are aligning the small intestine. They are basically connected via what we call tight junctions. But when we're having, for example, a lot of inflammation or disruption, whether it's from medications or stress or foods that we already know that we have sensitivities or allergies to, these tight junctions become leaky and allow, again, food particles, bacteria, and waste products to pass through. Now, where it gets even more complicated, not complicated, but more severe, is that when these particles are able to pass, basically we have another layer of tissue called GALT, which stands for gut-associated lymphoid tissue. What are we talking about? Basically, this is our immune system, or part of our immune system. And when our immune system encounters these foreign particles or particles that shouldn't be there, what does it do? It mounts an immune response, and basically immune response is just inflammation. And so what you're gonna encounter is this vicious cycle of tight junctions, becoming a little bit more open, allowing particles to pass. Our immune system doesn't like it, kicks up inflammation, and you guessed it, you're gonna be getting more destruction. One, along the GI tract, but also you're gonna be just having more inflammation in general. And when I talk a little bit further in this video about some of the signs and symptoms and conditions associated with leaky gut, you guessed it, it probably has a lot to do with inflammation. So that's just one of, just kind of give you some background of what leaky gut looks like. Another also big part, again, besides just the weakness around the tight junctions, we also want to talk about bacteria, and specifically one of the products of bacteria, specifically bacteria that we don't want, is LPS, which is lipopolysaccharides, which also increase this immune response. So what are some of the symptoms of leaky gut or leaky gut syndrome. Basically, some of the things that you would already think, different digestive symptoms, things like chronic diarrhea, constipation, bloating, pain. You're also going to see nutritional deficiencies, because one of the other things I didn't really mention when I was describing leaky gut is that in addition to creating these weaknesses in the tight junctions, it actually can compromise the villi, which are parts of the small intestine that are responsible for allowing certain nutrients to be absorbed. So you can also see that the villi can be compromised during this whole leaky gut picture. Fatigue, headaches, difficulty with concentration, lots and lots of skin problems. When I was in school, one of the things that we always talked about how our skin is very much the reflection of the gut. So anything from acne, eczema, psoriasis, unknown rashes, joint pain also is another, also associated with leaky gut. And then some of the primary conditions that I always think of, like when I have a patient coming into my office with one of these conditions, that I definitely think about leaky gut as a possible root cause. IBS, obviously, whether it's IBS associated with diarrhea or IBS associated with constipation, any of your inflammatory bowel diseases, things like Crohn's, ulcerative colitis. Diabetes also can be associated or be linked to leaky gut. PCOS, polycystic ovarian syndrome, one very closely related to diabetes, but also definitely leaky gut is something really to consider when I have a patient who has polycystic ovarian syndrome. Endometriosis, specifically around one, again, because if we think about how leaky gut can lead to lots of inflammation, endometriosis is much more a condition of inflammation, more so than even hormonal disruption or hormonal irregularity. And even there have been some very fascinating studies showing some causation regarding increase in LPS, remember lipopolysaccharides coming from bacteria, and the inflammation that women experience with endometriosis. Another one, another condition I see a lot in my practice that also is very much associated with leaky gut is Hashimoto's thyroiditis, because again, it is an inflammatory condition, and so having more inflammation due to the leaky gut can cause Hashimoto's, all kinds of allergies, not just food allergies. So that is one of the symptoms or signs when a patient who might have only reacted to one food for a while is reacting to everything. Definitely want to always think about leaky gut. So those are some of the symptoms and some of the conditions that I always consider when I'm thinking leaky gut as a possible root cause. So you might be wondering, okay, how do I test for leaky gut? Is there a test? So a couple things. So there is a standard test for leaky gut, though in general, I think everybody has leaky gut. And if you follow me on Instagram, I have a really fascinating Instagram live, which you can watch on my Instagram TV, one interview I had with Cheryl Paswater, and we talked all about gut toxicity, and pretty much everyone at some level, if you've ever taken a pharmaceutical, if you were born in the past 100 years, you probably have at some level some leaky gut. But that aside, if you really wanted to know definitively, one, if you have leaky gut and to what extent, the way that you would test it is by ingesting 2 different sugars. And these sugars, why we use these to test is that they're normally not absorbed in the body. One is lactulose, and if you've watched my video on SIBO and I talked about SIBO testing, you might have remembered that we use lactulose to diagnose SIBO. The other is mannitol. So both of these substances are typically not so much absorbed, and if you don't have leaky gut or have very low permeability, it shouldn't be showing up in your urine, or not to a very large extent. So basically all this does, all it involves is ingesting these two sugars that are typically not absorbed, and then testing your urine 6 hours later to determine if these are showing up in your urine, and that will help us determine the level of intestinal permeability. Though again, I'd say it could be a useful test, specifically if it's going to help determine some other things, but I really find actually determining the reason for the cause of the leaky gut to be much more informative. That's where like following up that test with SIBO, the gold standard of the 3-hour lactulose breath test, is very informative. Testing IgG, food allergies, doing a stool sample. So some of these can be a little bit more informative of where we should focus in the treatment. But again, if you wanted just to know if you had like definitively leaky gut, that would be the test that you would do. So if we know that you have leaky gut, which you probably, if you're watching this, you probably do, or again, as I said before, if you've been born like in the past century or so, you probably have some, to some extent, some leaky gut. So the main strategy we have, and you might have already heard of this term, of the 4 R's. So this is like the 4 R's approach to GI health in general. And so what do the R's stand for? Remove, replace, reinoculate, and repair. So first, like remove. So definitely we need to remove anything that is disrupting your gut. So whether it's medications, and one of the, because I work so much with women's health, one of the big gut disruptors I often see in my practice is hormonal birth control, but also overuse of NSAIDs. So things like aspirin and Tylenol all can have an effect on the GI tract. Just known toxicity. So again, if you want to watch or find out more about what are some of the other sources of gut toxicity, highly encourage you to see that interview I did on Instagram Live with Cheryl Paswater. Really informative. Food allergies. So anything that food allergies, food sensitivities, also food additives. So a lot of the preservatives have very negative side effects to the GI tract. Pesticides, also very much found if you're not eating a lot of organic foods. Got to be wary of pesticides. Stress. So stress, I'd say, is a big disruptor of digestion. And if you want to know more about how stress impacts our digestion, also on my YouTube channel, I have a really great video on stress and anxiety and how it affects and causes IBS. And then the last I definitely say is dysbiosis. And what is dysbiosis? But basically when you have an imbalance of good bacteria, bad bacteria, and even imbalance with the bacteria that you want. And my favorite way to test for dysbiosis or a level of dysbiosis is typically usually through the SIBO breath test, which is the 3-hour lactulose breath test. So that is remove. And then replace. So what are we talking about replace? Often we're seeing with patients who have leaky gut that there is some dysfunction just in digestion in general. And so that's either giving digestive enzymes, specifically breaking down of carbohydrates, breaking down of fats, breaking down of proteins, so lipases and proteases, and then all your different other enzymes. HCl, which is hydrochloric acid. So despite what one might think, we actually do want a lot of stomach acid, and stomach acid is really important for breaking down protein and also being able to activate and absorb B12. And that I forgot to mention, again, like when we talk about remove, PPIs, proton pump inhibitors, which decrease stomach acid, can also increase leaky gut. Bile salts, so bile or also like ox bile. So I definitely see specifically with my patients who have had their gallbladders removed, there can definitely be a higher percentage of these patients experiencing symptoms of leaky gut, and we need ox bile for optimal digestion. Renoculate, I think we might understand what that means. So basically bringing in the right bacteria, the right flora, so via probiotics or fermented foods. One of the things also that's really important is if you are someone who've noticed that when you take probiotics, you actually feel worse, it's usually definitely a sign of dysbiosis, and that the dysbiosis needs to be taken care of. And I'd actually, again, like going back to like the remove section, so if depending on whether it's yeast, whether it's bacteria, we definitely need to get rid of the bacteria that is not serving you before we would definitely start you on a probiotic. Then in addition to probiotics, prebiotics, which is basically bacteria food, and usually basically plant fibers, and whether you're choosing a probiotic that already has the prebiotics in it, or just making sure that you're getting enough fruits and vegetables. And if you tolerate legumes, things like lentils and beans can be really just a great source of prebiotics. And then lastly, repair. And so basically giving you specific nutrients and herbs to help you to restore gut mucosa. So we really do need to first eliminate what is causing, like what is literally bugging your gut. Then we have to make sure that your digestion is optimal. We bring in the good probiotics, and then we repair the gut. So what are some of the supplements that I often recommend to patients when I'm healing the gut? So first, looking at mucosal supportive nutrients. So my top ones are glutamine, which is kind of basically, I like to call it like gut cell fuel, zinc carcinosin, specifically zinc carcinosin versus other forms of zinc. And this type of zinc really helps to bring down gut inflammation and to really help. It's one of also my favorite go-tos for when I'm working with acid reflux and really helping to like calm down any like esophagitis that can be happening. And then N-acetylglucosamine, also really helpful for restoring mucosal linings, whether it's the GI tract, or because I also work with patients with interstitial cystitis, that is one of my go-tos for helping to heal the bladder mucosa is N-acetylglucosamine. Then antioxidants, so again, if we're thinking about destruction, we're thinking about the production of free radicals, and if you have all these free radicals, you're going to have more destruction. So my top picks are vitamin C, which also is really good just for any connective tissue and in general, selenium, glutathione, and N-acetylcysteine. Then for more like soothing, we think about demulcent herbs. So these are things like slippery elm, marshmallow, DGL licorice. So basically that's a form of licorice where they removed one of the components that can cause high blood pressure. So this allows patients to be able to have the therapeutic properties of the licorice without causing high blood pressure. And aloe. And aloe you have to be careful with. I love prescribing aloe juice, typically usually part of this kind of protocol. Definitely want to choose ones that don't have added sugars or artificial sugars, but then also just being mindful that there are certain components of aloe that can act as a laxative, and sometimes it's a desired effect, but not always. Your anti-inflammatory herbs are also going to be very useful, specifically turmeric, and the type of turmeric or curcumin that I typically will recommend for patients is the Mariva, because one of the problems, actually, even though turmeric is so great anti-inflammatory, it's not that bioavailable, meaning that we don't absorb a lot of it. And so the Mariva form of curcumin is connected to a phospholipid, and all that really means it's connected to a fat, and so it gets where it needs to go and be able to pass through membranes and things like that. Our digestion support, and I already mentioned HCl and digestive enzymes and bile, but also probably my first go-to actually is digestive bitters. And so these are herbs that have a bitter taste, and it's bitter that the taste of bitter that actually stimulates our appetite and tells our body, tells our stomach to kick up the stomach acid, and it tells our pancreas to start giving us some enzymes to like aid in digestion. Another, also an alternative or another digestive support, apple cider vinegar. So apple cider vinegar taken with meals can really help with digestion. And then finally, probiotics. And when I prescribe probiotics in my practice, it's definitely very specific to the patient. One strain of bacteria in particular that can be really helpful is Saccharomyces boulardii, and it's really I use that pretty much with most of my patients, specifically patients who have unfortunately had to been on antibiotics, because it's one of the only bacteria that is not actually killed by the antibiotic. So it's a very good probiotic to add, is Saccharomyces boulardii. And also, again, with the probiotic, I'd say, again, obviously, if you're having major digestion symptoms with the probiotic, most likely have dysbiosis, but also sometimes it makes more sense, or depending on the case, to go lower dose than higher dose, because you might be seeing products like with 50 billion, 100 billion, that it might be much more appropriate to start with 15 billion, specifically if you're more sensitive. So now the supplements, but you might be wondering, okay, so how do I eat if I have leaky gut? And I'm very much of it depends kind of naturopath. So the first basics of a leaky gut diet, without more information, is basically similar to like a very like anti-inflammatory diet. So reducing sugars, reducing alcohol, eliminating refined carbohydrates, eliminating any known food allergens or potential food sensitivities, additives, so like artificial sweeteners, artificial colors, preservatives, being very mindful of incorporating more organic, pesticide-free foods. There are some non-organic produce that have a lower pesticide or don't have a pesticide burden. So if you're trying to save some money, you can always go on the Environmental Working Group and refer to their Clean 15 and their Dirty Dozen for more information, and they do update that yearly. So if I told you what those foods were today, it's most likely it has already changed. And then when I'm working though with patients individually, sometimes it makes sense for me to put them on what's called the GAPS diet. So that's the Gut and Psychology. I always can't remember what the exact acronym is. It's a very step-by-step approach. One of the big things is the elimination of all grains, elimination of all beans, dairy products, etc. But it goes through a much more specific step-by-step approach. I find the GAPS is one of my favorite go-tos, but not everyone has the discipline to go through it, but I have seen such amazing results when I have put patients on the GAPS diet. And then I think I do also talk about this in my SIBO video, but a more very stringent approach that I will sometimes use specifically with very severe SIBO cases is the elemental diet, which typically lasts about 2 weeks. It can be very challenging as the patient, or is that you basically just drink this one. Basically, it's a formulation of all the nutrients that you would need, plus your macronutrients, but it doesn't contain anything that would feed any kind of bacteria. And I find like that can be very, very useful for a lot of patients, but it's definitely something I wouldn't advise doing on your own. You definitely want to work with a practitioner. So that's the dietary recommendations. And so hopefully you found this video helpful. And if you did, then I definitely encourage you to subscribe to my YouTube channel, where I have videos on lots of women's health, digestive health, mood disorders and sleep, but also I encourage you to let your friends know about this video, and hopefully that they would also find that very helpful. And of course, you can also follow me on Instagram And you can always also check back at simplicityhealthassociates.com. There are actually a couple supportive blogs based on today's video that might help you also implement some of these changes into your life. And anyway, as always, thank you so much for joining me. My name is Dr. Ivy Branin. I'm a naturopathic doctor of Simplicity Health Associates, and I'm looking forward to seeing you next time. Have a wonderful day.